Hi everyone, Dr. Tim Sylvester here from Grace Chiropractic. I want to share with you a simple test that we do in our office that helps me determine whether your body's in or out of alignment. And as chiropractors, we see lots of people with knee pain and hip pain and lower back pain, and this is one of the assessment tools that we use to determine if you're in alignment and what could be at the source of the cause of your problem. And what I'm referring to in this test is something called a bilateral weight scale test. And what we do as chiropractors when we check postures, one of the tools that we use are scales like you see down here on the floor. And what I'm going to do is I'm going to have my assistant Jessica, she's going to come over here, she's going to stand on the scales, and I'm going to show you how we use these and how we determine if your body's in balance. So Jessica, if you just come on right over this way here. And what we do is we have her place a foot about shoulder width apart on each scale here. You can bring your feet in just a little bit closer here, Jess. That's the way. And we wait for the scales to settle. And once they're there, we just lock in the numbers there. And then I'll have you step off now. And if you just come in a little bit closer, Sharon, what we notice here is that on one side of her body, she's bearing about 40 kilograms, and on the other side, about 35. So you can see that there's a discrepancy here, about 5 kilograms more on that right side. And what that can do is bearing more weight on one side of your body, as I said before, can predispose you to problems in your knees, your hips, your lower back. It can translate its whole way up your spine. And essentially, when we see a problem like this, it could mean a couple of different things. It could mean that Jessica has a leg length inequality, that she's literally got one leg that's shorter than the other. And that could be because she's physically got one leg that's shorter, or it could just be that the bones in her pelvis are out of place. Having a misalignment or a subluxation in the pelvic area can cause the legs to become imbalanced and cause a difference in the way that she bears weight. The other thing is if there's a shift or a misalignment in the spine itself, something called a scoliosis or a translation, that can also cause the kind of problem that we're looking at here. So if you suspect, if you're a person that maybe you notice that one pant leg seems a little bit longer than the other when you get your pants tailored, or if you've got a suspicion that maybe your one leg is longer than the other, or there's a bit of an imbalance there, I would encourage you to get checked by a local chiropractor, because that's really important. That's something that over the long term can lead to bigger health problems, because the more that your spine misaligns, the more pressure it's going to put on not only the nerves, but the spinal cord on the inside as well, which can affect your whole health and your whole body. So I hope you found this small test that we use in our office helpful. Again, it's called a bilateral weight scale. And if you know someone that you think is out of alignment, please feel free to share this video, tag that person. And if you need any more information at all, please visit our website. It's www.gracechiropractic.ca. Thanks so much. Have an awesome day.